Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a nice example of ovarian yolk sac tumor arising in a postmenopausal patient. So this is a case of a 58-year-old female patient who presented with abdominal pain and was found to have a large right ovarian mass. And as you can see here from the low power magnification, there is this prominent glandular proliferation lined by those atypical, highly atypical epithelial cells. And on high power magnification, these are the glands, variably sized, and the lining cells show abundant clear cytoplasm, vesicular nuclei, and prominent nucleoli. This is another field where we have the glandular formation, and those cells lining the glands really composed of abundant clear cytoplasm, vesicular nuclei, prominent nucleoli, more than one nucleus at some instances. And this is again a beautiful example of one of those glands where we have really the large cells with the clear cytoplasm, the very pleomorphic nuclei, prominent and nucleoli, and then mitotic activity and apoptotic figures. And again, a larger gland, a smaller gland, all lined by the same cells with the abundant clear cytoplasm and those nuclei with the prominent nucleoli. One of those glands is beautifully shown here with the clearing of the cytoplasms. Now, some of the glands contain those acidophilic globules within the cytoplasm of the tumor cells. What was really also noted is that the stroma in between the glands focally contain those aggregates of what look like to be like endocrine cells with monomorphic appearance, vesicular nucleus, small inconspicuous nucleoli, and the granular cytoplasm. And here again, those large glands, those glands lined by large cells with abundant clear cytoplasm. And look at the prominent nucleoli and then the globules. And in the background here and here, we have those stromal cells. Now, the first thing that would come to mind, given the age of the patient, is a clear cell carcinoma. Botnapsin A was completely negative, zero negativity. What was really beautifully positive was SAL4, diffuse strong positivity in each and every nucleus, as you can see here in the glands, regardless of the size of the gland, as was a glypican-3, which showed the cytoplasmic granular positivity beautifully in the gland. Now, alpha-fetoprotein was only focally positive. And in yolk sac tumors arising in adult patients, this is the typical triad immunohistochemistry, where we find strong positivity for SAL4, strong positivity for glypican-3, and focal positivity, weak focal positivity for alpha-fetoprotein. OCT3/4 was only focally positive. Now, P53 showed null type staining pattern, meaning that this is an abnormal expression of P53, or what we quote as a mutant P53 expression. WT1 was also focally positive in some of those glands, pointing towards perhaps a precursor to the yolk sac tumor development, which is high-grade serous carcinoma of the ovary. Now, the cells in between, the neuroendocrine kind of cells in between the glands, here is one gland and here is the other gland, was positive with alpha inhibin as well as SF1, supporting that these are only stromal cells in the background, hyperplastic stromal cells, as a result of the reaction to the tumor formation. So to sum up, the final diagnosis of this case is yolk sac tumor, probably arising on top of or in association with high-grade serous ovarian carcinoma. Now, yolk sac tumors are rarely reported in adult and elderly females, in postmenopausal females. These are mostly considered to be somatic malignancies arising as a kind of differentiation in other types of tumors, in particular serous ovarian tumors or even ovarian endometrioid carcinomas. Now, unlike their counterpart in young individuals, these tumors are aggressive and necessitate really aggressive treatment and management. Remember the triad: SAL4 positivity, glypican-3 positivity, and only focal positivity with alpha-fetoprotein. And remember, whenever you encounter a case of ovarian and occasionally endometrial tumor with a clear cell carcinoma morphology, but is not staining like a clear cell carcinoma, you should exclude the possibility of Yolk Sac tumor. I hope you find this tip useful in your daily practice. Thank you.